Talk about how important it is to protect yourself from influenza by getting your flu shot. But what if there was one shot that could protect you for life? What? Health specialist Leah Sarich is here now with the latest research, and
Isn't this exciting?
has a lot of people paying attention.
I know, as it should, because it's very exciting. So a new study's come out following the 2013 outbreak of that new bird flu that happened in Asia a few years ago. And what researchers did is they tracked patients that were infected with the flu from the time they arrived in the hospital to the time they either left the hospital or died. And what they found out was quite startling. They basically discovered a whole new way that our body fights the flu, which is incredible. It has to do with the early killer T cells, these killer T cells. And what they do is they basically fight off this influenza in a whole new way that they didn't understand before. And researchers here at U say this finding could lead to a whole new way of creating an influenza vaccine that could last for years, not months.
What we've been targeting for a vaccine is to make things called antibodies, which bind the virus, neutralize it, and prevent it from infecting our cells. This new part of the immune system was actually recognizing infected cells, so little bits of the virus that are inside our own cells, and then it would come in and it would kill just that infected cell before the virus could spread. So it's a slightly different approach to immunity. It's a slightly different strategy for vaccination. We're not neutralizing, we're actually killing once it infects. But because of that, we can target the little things inside the virus rather than the ever-changing coat.
Right, so he's talking about the coat. So it's really that coat or outer layer of the flu virus that always changes, and that's why we need a new flu shot every year.
Right.
But what this research shows is that the flu virus can change the mechanics inside of it. So if researchers can harness that unchanging part, then they can come up with a new vaccine. Now, Dr. Jenny says it would be likely different than what we're doing right now, because what we're doing right now is injecting a live virus, not the dead one.
Right.
But what we would have to do in this case, likely, it would be similar to basically the measles vaccine, where you're injecting a live virus, but it's a weakened virus. So we would let it infect a few cells, and then that would allow our body to build that immune response.
Right.
So the implications are huge. One shot for life, or even a decade. This has huge implications, because what this means, of course, is so many fewer hospitalizations, so many fewer deaths, and this is amazing. Because even this year, if you recall, we had not a perfect match with our flu shot, and even when we didn't have a perfect match, the incidence of mortality went up huge, and so that is something we have to pay attention to. It was certainly more of a deadly season.
This last flu season, we had a flu shot that wasn't a perfect match. It still worked, it still protected most people, but that little bit of a mismatch, we saw an increase, a record number of deaths this year because it wasn't a perfect match. And again, having one flu vaccine that works for all flu would avoid, trying to guess every year or the virus mutating.
And that's what we want to do, right, is try to avoid that guessing. But even though researchers are really good at guessing, I mean, generally they get it right. So it was just a little bit off this year. But you can imagine how many more deaths would have occurred if we had no protection at all. So we have to keep that in mind. But you can also imagine, as I said, if we didn't have to worry about this virus mutating as it does right now. So this would have a huge impact on health, of course, and it would have a huge impact on our healthcare system, saving us millions and millions of dollars. And the other really exciting thing, too, about this research is that doctors may also be able to better predict who will do well at fighting off the flu earlier, so they can do interventions earlier if they need to, depending on how that person produces these killer T cells. So it's very exciting research, which we're going to definitely keep an eye on.
Yeah, this is a great big deal here at the
it is huge. It is.
More information on your blog.
More information on my blog, absolutely.
Breakfasttelevision.ca is the way to find health specialist Leah Sarich. Thank you very